All right, the topic is biologically safe systems for rebuilding host resistance. For those of you who might not have been here before, let me introduce myself. I'm Ruth Sackman, president of the Foundation for Alternative Cancer Therapies. Well, thank you. Which will shortly be called the Foundation for Advancement in Cancer Therapy. I don't know whether Susan Silberstein explained why, but it's because the word alternative has become the garbage pail for just about anything and everything that is not accepted by the medical community. But we do accept some therapies that are accepted by the medical community. Now, we can't refer to those as alternatives. Now, those therapies are what they call biotherapies. Things that will do no harm to the patient. That's the first thing you take into account. Once there's a cancer diagnosis, you know that the body is out of order. You don't want to cause additional harm to that body, but you want to use whatever value is there to begin a total rebuilding process. And so we do support the biotherapies because they don't do harm. The biotherapies would be immunotherapy, used without chemotherapy, because that's a violation, and yet the medical community has a tendency to combine the two. But if you're using immunotherapy to restore the immune system, because it's an important defense process, it will destroy cancer cells. It will not allow cancer cells to find a haven in the body. It will eliminate them as foreign material. But if you combine the two, this is what you're doing when you use chemotherapy with immunotherapy. One is attempting to restore the immune system, and the chemotherapy is destroying the immune system. Chemotherapy is an immunosuppressive drug. When chemotherapy is used very often when people have transplants, heart transplants, liver transplants, and so on, to suppress the immune system so that the immune system will not reject what it considers foreign material, the incidence of cancer in those individuals goes up about 1,000%. So in order to select a therapy, you've got to have certain concepts about why they're presented to you, why they will work for you and possibly not for anyone else. I think we had asked Louise Greenfield in her talk to make it clear to the audience that that program worked for her, that it will not necessarily work for everyone. And I think it was explained, and I want to repeat it because I think many of these things warrant repetition so that they're established in your being as part of your own thinking. And that is that if there's any impairment, any biological impairment, in other words, if your liver function isn't good and can't necessarily repair that well, or thyroid function isn't very good, and you're going to need supplementary thyroid material, or pancreatic material, or adrenal material, do you see? Then that type of program is not going to do the job that you expect it to do. You're going to have supplementary material to take care of the problem. Let me elaborate on that a little bit. Your parathyroids actually have control over proper calcium metabolism. Calcium is one of the most prolific elements in the food chain because it is required to do so much work in the body. Nature has created a marvelous design. Now, if the thyroid isn't functioning well, we don't have any way to support the parathyroids, but usually when you support the thyroid function, somehow or other, it also helps the parathyroids take care of the calcium problem. You've got to have proper calcium metabolism. If you don't, you're going to fail. And so they use material to support the thyroid, and it, of course, in turn helps to equalize the condition that is out of order. and so on with pancreatic enzymes or adrenal substances. In every way, you've got to try to return the body back to normal function with whatever supplementary material is necessary, and of course with the dietary program. There is no place on earth that anyone's body is going to get the material with which to build healthy cells except out of that food supply. So many people make an attempt to find someone with a fantastic program where they're going to get that quick fix from an injection or a tablet of some kind or a tonic of some kind, and they sit back and they wait to recover. Many of these things will make the patient feel better, make him feel that he might be doing better than he would have without it, but it is usually a temporary system. On rare occasions, there might be an individual who will actually do better. Sometimes it's an attitude. The attitude plays a tremendous role in the healing of the body. And they might feel, of course, that this is their success story, and it might actually work to be the success story. But we would rather have patients not use systems where it accidentally works for them, but it is wiser to use a system where you know you've covered all bases. Don't you think so? All right. So that you have a total program which is also going to include attitude. There's hardly a doctor who does good work who doesn't include attitude. So you can see where we cannot employ methods where you're taking a shot of something. And I'm going to tell you in more detail what we're thinking of, specific therapies. People often ask us, well, which therapies don't you support? And we'll give them an overview of what we don't support. But I'm going to be much more specific with you today. It's about time we took that role. We don't want to antagonize. It isn't even antagonize some of the people with whom we don't agree, but we have to take into account this organization has a policy. It has a standard. If people come to us, we've got to utilize that standard for them. They always have the privilege, if they don't approve of our standard, to look elsewhere. But we're going to work with that standard and stick to it. Now, for instance, there are people who've been proposing a Dr. Ravisi. And there are some people who are claiming success with Dr. Ravisi. Now, I want to tell you why we don't refer patients to Dr. Ravisi, because we don't feel that it is a total enough program. For one thing, he's using elements to try to recreate acid-alkaline balance. And we know that acid-alkaline balance is a very important part of recovery when you get the body into proper acid-alkaline balance. And it can be done with a food supply. When you do it with an injection, for instance, using selenium as one of the products, if you go too high in the selenium area, beyond the trace amount that the body requires, you're beginning to use a toxic material. Selenium is very toxic. Many of the things our bodies harbor in trace amounts are toxic. They're essential in trace amounts. Beyond those amounts, you must realize you're dealing with toxic material. So that's his program. Now, we also are disappointed because no nutritional program can be combined with that system. Not if you're going to listen to your doctor. And Ravisi does not combine nutrition with that program, doesn't understand nutrition, doesn't feel it has any merit in the system with him. Now, we're looking for real recovery, not temporary recovery. And so we take every facet of the body into account.